Now, more than 4 years after the Grenfell Tower fire, up to 500,000 people are still living in blocks of flats with flammable cladding and fire safety issues. It has left many feeling scared and trapped in their own homes. Well, now a new study of those caught up in the cladding crisis has found that some are being treated for anxiety and depression on medication, with some even having thoughts of self-harm and suicide. Sarah Corker has been given access to the report.
Are you okay?
Sophie bought her first home in Chelmsford just weeks before son Reuben was born. A proud moment, but all that quickly changed. Which bit of the building is the problem?
So all of this is ACM cladding.
That's the same type of cladding as Grenfell. To remove it could cost flat owners thousands. And living here is taking its toll on Sophie's mental health.
It's kind of like that crippling depression where you can't get up. Just couldn't see the point in anything. And I've had such bad issues with my anxiety. Some days I feel like I can't leave the house, and I have like physical problems leaving the house because I all feel so sick.
Sophie's now been prescribed anti-anxiety medication, and her doctor was so shocked by the cladding situation, he wrote to Sophie's MP imploring her to raise the issue in Parliament. The Housing Select Committee has warned that the cladding scandal is becoming a public health crisis, and psychologists have told the BBC that people living in these conditions with no end in sight will need long-term counselling and support to get through it. New research by the University of Sheffield, based on a series of in-depth interviews, found the situation is having a catastrophic impact on the mental health of some leaseholders.
Things like just feeling that they couldn't go on, that they were trapped and that they couldn't see a way out of this crisis was leading to feelings of suicide and self-harm. And in those situations, individuals had to seek immediate help either for themselves or for a member of their household.
It's like having a ball and chain wrapped around your legs.
Will is a junior doctor who owns a flat in Sheffield with dangerous cladding. So I'm going to show you this video diary you did a year ago to see what's changed for you.
I'm just so exhausted and so tired of this situation. It is so consuming.
An absolutely fantastic supporter of us.
Campaigning for change has helped him cope, but Will deeply regrets his decision to ever buy a flat.
I was so embarrassed. I was utterly ashamed that I, like a sensible person, had made this colossal mistake, like this huge error of judgment, and that the impact it's had on my mental health will stay with me forever.
The government says it's allocated £5 billion to make the highest risk blocks safe.
But we also have a responsibility to relieve some of the obligations that are being faced by leaseholders at the moment, who are innocent parties in this.
You can hold my hand.
Back in Chelmsford, since we filmed with Sophie, the developer has now agreed to pay to remove the dangerous cladding. It's a huge relief, but for thousands of others, the wait for help continues. Sarah Corker, BBC News in Essex.
Well, I'm joined now by Sophie Bitchener, who owns a flat with cladding. She got a bill for £200,000 to make her property safe, and it isn't yet clear what government support she's going to be entitled to. Thank you very much for talking to us. Just tell us a bit more about your situation.
Yeah, so my building has all sorts of fire safety defects, from missing fire breaks, potentially flammable cladding and insulation, missing smoke seals, and a couple of other things. In January this year, we were told the remediation bill will be £14.9 million, which for me is £200,000, which I've had as an invoice and a demand for that money. But until we get an answer from the government and we get an understanding of if there's funding available for us, we've been told at the moment not to pay that. And could you pay that if you had to? No, not even close, which makes it all a bit more unbelievable for me and also my neighbours and everyone caught up in the building safety crisis, that these bills that are dropping are not even remotely affordable. And how stressful is all of that on you? It's been really, really stressful. I mean, it's been almost 2 years now that we've known the building's potentially unsafe. So living in that building, as well as having these financial concerns over my head, has been really, really stressful. In January, at the start of this year, I had to reach out to my GP and was diagnosed with anxiety. and had to start medication for that. But as mentioned in the mental health report, my GP said, we can talk about this and we can give you medication, but this is a trauma and it's likely that it's going to have to take years of sort of counselling and PTSD type symptoms because it's been so distressing.
You must be pretty angry about that because, I mean, it's been, 4 years since the Grenfell fire and this has just been rumbling on, this whole cladding crisis. Yeah, and the problem is, while I say I own my building, I'm a leaseholder. I essentially don't own a brick of the building. We have a freeholder and we have a developer who knowingly didn't put fire breaks in our building and used this material and didn't add smoke seals to our front doors. And yet, because of the way that leasehold law is, we are left to pick up the pieces and fund the remediation of the building. The building essentially has to be ripped apart and rebuilt. And there doesn't seem to be anyone accountable for that other than the leaseholders who just essentially are renting for a long period of time. Does anyone talk to you? I mean, does anyone sort of try to reassure you or give you any help or support or advice? We've heard quite a few times from government now, I think maybe 17 from different ministers, that they don't think that leaseholders should pay unaffordable costs and put these defects right. But whenever we hear that, the reality is these bills are landing now, and even for leaseholders who are in buildings below 18 metres or in shared ownership buildings, there's no funding available for those people. So, I have the hope of maybe getting funding, but there are thousands of people out there who don't have that hope, and that's where the mental health aspect comes in, because it's just crushing and it's an unending crisis. Well, Sophie, thank you very much for sharing that experience with us, and I hope things improve for you very, very soon. That's Sophie Bitchener. Thank you. Thank you.